have a feeling that he does because, you know, there's apps for everything. But Dr. Jeremy Groll is here to help you plan a pregnancy with some apps. He's going to break it all down. And what's in your pocket?
Well, we got our own Pokemon, so caught this at our office.
Can you guys see this?
Thought I'd make sure a guest appearance here for us. So
well,
that's Meowth.
And you probably learned some great tips from Jerry Deere on maybe incorporating Pokemon into your business.
Absolutely, and so that we got all sorts of eggs and things in our office, so that great place for finding new and growing your Pokemon as well as your family. So hopefully folks get their own Pokemon out of the venture.
So if we are trying to grow our own baby, you know, there's a lot of things we can do. We can come and see you, and you really help us with all of the questions we have and processes. But there's some electronic apps we can use on our phone. Tell us about this.
Of course, and just like they said, there's an app for it. And, you know, it's so funny now that folks come in and you ask about their cycle or such, and they go to their phone and they pull it up. And there really are some great things. And it's what's really helpful about these is they help women learn about their bodies and learn how their cycle works. Okay. And now, with that, they generally are going to take your calendar and your planner, and they'll, you know, keep track of when your ovulation should be occurring in accordance to like how long your cycle is. So everyone's a little bit different, and some women are 26 days, some women are 35 days.
Okay.
But what's almost always consistent with a normal cycle is that about 2 weeks from the time you ovulate to when the cycle would start. And so what they do is they calculate backwards from your normal cycle and then give you the time when is going to be about the time of ovulation, which is the best time to achieve a pregnancy.
So we have the three up on the screen there, Kindara, Glow, and Baby Bump. Can you touch on those just a little bit?
Sure, and these are some of the most common and the most frequently downloaded apps from your app store. And what they do is they, you know, do those calculations, but they have some other great features. And so, for instance, the Kindara will allow you to actually take some other ovulation testing. So if you do the other tests, like your urine dip test that you get over the counter, you can plug that information in, and so now it's that much more accurate, because then you can see, is your cycle working normally?
Sure.
And so that that way, that adds so much more accuracy. And because when they do the calculations just on its own, they're assuming your cycle's working normally. But if we're seeing delay, oftentimes that may not be the case. Yeah. So you may ovulate, say, on day 20, and then have a 26-day cycle, which means we're ovulating late, and then it's kind of weak, so it falls off short. So by adding the ovulation test to it, that really helps you get a better grasp of the whole picture. So the Kindara will help you, you know, plug that information in, as well as other potential tests like the temperature testing. So different ways we can get that info.
That's wonderful. Dr. Groll, these are some apps that you recommend. When we come in, you know, if we can even say we saw this segment on Living Dayton, I want to talk about those. I want that baby this year. We come to 7095 Clio Road in Centerville and can talk to you, right?
That's right.
Wonderful. Thank you, Dr. Groll. SpringCreekFertility.com if you have more questions and as you're trying to grow your family. Thank you for being here.
Thanks, Katie.
All right, stick